You know health insurance is important, and you also care about value. But have you ever thought about just how valuable your insurance is? The money you pay every month for your insurance is called your premium, and it sometimes can seem like a lot, but just think of it as a single brick in a wall of protection. One brick won't do much, but with everyone contributing, you're protected if you really need it. Even when you have insurance, you'll sometimes need to pay a doctor. This is called your cost share. But you can choose from networks of doctors who've agreed to a specific amount they can charge for procedures. Small tailor networks can save you even more. And medications also have agreed upon costs. Your insurance protects you, sure, but if you don't have an emergency or an expensive procedure, it can be easy to forget that there's still a lot of value in your plan. Annual wellness visits, what we sometimes call physicals, are covered at 100% and help keep little problems from becoming big ones. You also get things like flu shots and regular tests to make sure you're healthy. But there's even more. Everybody loves perks, and you'll find lots when you look in your plan. Plans offer discounts on gym memberships, wellness programs that reward healthy choices, and all sorts of other health-related discounts. And as a Blue Cross and Blue Shield of Rhode Island member, you can go to Your Blue Store, a new approach to healthcare where you can take classes on fitness and healthy eating, meet with nurses and dietitians, and get questions answered on your plan. It all adds up. But of course, the real value in health insurance is peace of mind. Having insurance when you really need it, well, that's a hard thing to put a price tag on, but it could save you thousands and thousands of dollars. For more information, go to roadahead.com/unboxing. For more videos like these, be sure to like, subscribe, or go to roadahead.com/unboxing.